If the Ministry of Health failed after the 2 weeks to get back to us positively, what am I saying? If the Ministry of Health failed to get back to us positively after the 2 weeks, I will call this bally by, and at that time now, our force will be more than this. Yes. So, there's an appeal. I want us from here, I want us to go in the chapel. The president from the Color Union is here, so he can also give you a word. Then from there, we can Dr. Poto. Dr. Poto, has it been resolved for a while now?
Some positive answers, certain percentage of the petition that was made. But I think what they were saying January, they can be workable.
So how were you trained in the meeting you were attended with the ELWA management?
It was a very cordial meeting, and they recognized that they had some lapses.
Did they express willingness to address these concerns?
We're meeting them tomorrow at the Ministry of Health by 11. But they did apologize to the workers.
Would there be any mention taking, any punishable action taken against them?
So we have to work with labor ministries. Yes, we have to work with
ministries. ELWA is not the
only all of counts to be taken.
Okay. Spoon TV Live. The workers have returned to work following a meeting with the Minister of Health, Louis M. Poto, the Chief Medical Officer, Madam Catherine Thomas Cooper, and the leadership of the ELWA Hospital and the Workers Union on one hand. So based upon that, as you can see over there, the workers are returning to work. The workers are returning to work based on based on the intervention of the government of Liberia, the workers have agreed to return to work. Spoon TV Live, normal activities as of this time. In a few minutes, because some of them are still returning to work, some of them are still on their way into the building. But basically, in a few minutes, normal activities will resume at the ELWA Hospital following the intervention of the government of Liberia. So let's hear from the Workers' Union president.
Several meetings with them. I have some document, I have some email that we exchange on this matter, but all failed.
Management will somehow push the insufficiency of funding to the UC that left. You are aware that UC is supposed to be.
Well, I'm not aware as well as you say was supposed to be this institution, but this institution is a private institution. Patients that come here pay their bill. You can imagine some people here pay bill up to $200,000 Liberian dollars. I pay somebody bill here that was $100,000.
Okay, so folks, that is it. Here, as you can see, the road there, the road is cleared off. The health workers, the nurses, they've all returned now to work. Normal activities have resumed here at the ELWA Hospital. So what was the conclusion? What was the intervention made? So following the meeting, the Minister of Health spoke with the press, and she did say that the management or the leadership of the ELWA Hospital does recognize, most of the points, the contents of the petition of the workers of the hospital. They even apologized in the meeting and expressed the willingness that they are going to, in line, in collaboration with the government of Liberia, or specifically the health ministry, see how best they can address the workers' concern gradually. So it means that the workers, had a valid and genuine concern. The concerns are realistic for the fact that, the management, apologized during the meeting to them. It means they have a valid point, and the Ministry of Health, now headed by Dr. Luis Poto, will now work in collaboration with the management of the hospital to resolve this matter. But the promise was that some of those concerns will be addressed in 2 weeks. In 2 weeks, they're going to work with the management of the hospital to begin to address some of the concerns. And the leadership has said after the 2 weeks, if nothing seems to be working, they will definitely return to their protest action until they can see, their plans being resolved. So basically, that's what happened here on today. Temporarily, normal activities here got stalled from 6 o'clock this morning up to this time. So it's already 11 o'clock. It's 11 o'clock now. But if you are out there and intending to, or had intended earlier on to come to the ELWA Hospital to seek medical service, and the protest action stopped you, well, right now, I think you can begin to make your way, because normal activities in a minute or two will resume. It's been a wonderful time here. You see the health workers now, they are returning. They are, satisfied to some level for the fact that the government can intervene and give them assurance that in 2 weeks, some of these concerns will be addressed. Some are saying the 2 weeks ultimatum given is too long. That's why some of the workers are saying that the 2 weeks ultimatum is long. Can I enter? Go for the chopper? Okay. Okay, folks. So the workers are now going for the chopper to begin work for today. And so that's how I would like to wind down. That's how I would like to close on this live coverage. We've been here since 6 o'clock this morning, bringing you protest action by nurses and doctors here at the ELWA Hospital, who have been, protesting against bad labor practices here at the hospital. There were several accusations made. Low salaries, according to them, the hospital is paying below the minimum wage bill. Some of them have in fact, their benefits, retroactive benefits, their social security benefits have not been paid over the years. So based on these, plus many more, like the lack of buses to aid them when it comes to transportation to work, is a serious problem. They stated that one of their workers, was involved into an accident while riding a tricycle, and her leg got broke three times. And because of that, today she's, suffering from the pain at home. And another concern was that the hospital does not have an ambulance, which is very concerning for one of Liberia's biggest hospitals now to have an ambulance to be able to transport patients in terms of emergency situations is something of serious concern. So those were just some of their concerns, some of the plots for which they assembled here this morning protesting. And earlier on, the Minister of Labor came in to intervene, and he requested that the leadership of the protesters or the workers, goes with him to his office at the Ministry of Labor. But they did refuse on grounds that, the leadership has communicated to the Ministry of Labor about some of the bad labor practices here at the ELWA hospital on several occasions. But then the Ministry of Labor has not been able to, take their communication seriously to address their concerns. So it was on that ground that they, hesitated or refused, to go with the Minister of Labor, Kopo Kra, who was the first government official to come on ground. And then later we saw officials from the Ministry of Health. The Chief Medical Officer was here, Madam Catherine Thomas Cooper. And then we later on saw the Minister of Health herself, Madam Koto, Louise M. Koto, later arrived, and they went into a closed-door meeting with the leadership of the protesters and that of the leadership of the ELWA Hospital. And following that meeting, the minister, appealed to them to return to work, and that in 2 weeks, the government will begin to address some of the concern, not the government, but the government in collaboration with the hospital is going to ensure that some of the concerns contained in the petition, are addressed. Yeah, so that's basically some of the happenings here this morning. Is been tense. Patients in admission were temporarily not catered to, even though when I came earlier, I spoke with the workers' union, the protesters' leadership, and they said they planned the protest in such a way that some health workers were indoors, catering to patients who are in admission. But some of the caretakers of the patients in admission came out, some of them crying, some of them complaining that there's no health worker since this morning to take care of, their mothers, their relatives that are in admission here at the ELWA Hospital, contrary to what the worker union leadership said. So basically, folks, that's it. It's been a wonderful, wonderful time here on behalf of the entire Spoon Network. My name is Yekezi Zwobel. I've been here providing you all of the necessary information and other details that you needed to know about this ELWA protest. So as you can see, the entrance is now clear. If you had intended to come to the hospital here at ELWA for medical service, I think you can now come. because everything is now is on course. But you just heard some of the workers saying that the ultimatum is too long. The 2 weeks ultimatum given by the government, or agreed upon by all of the representatives. That is representative from the government, from the hospital leadership, and from the workers. Some of the workers are saying the 2 weeks is too long, but I mean the leadership has collectively agreed. The protesters have agreed to, return to work, and they are currently in chapel, to say some words to God before resuming normal activities. Again, I'm Yekezi, bidding you a pleasant goodbye and thanks for following.